Imagine, for a moment, a world where the relentless HIV epidemic, a crisis that has haunted humanity for more than 4 decades, finally begins to recede. Not because of a miraculous vaccine, but because of a simple, twice-yearly injection. This vision, which would have sounded like science fiction only a few years ago, is now inching closer to reality, thanks to a groundbreaking medication, lenacapavir. In June of this year, the Food and Drug Administration issued its final approval for lenacapavir, a medication developed by Gilead Sciences and hailed by leading scientists and public health officials as a potential turning point in the fight against HIV. Some are daring to whisper about the possibility of ending HIV as a public health threat. Yet, paradoxically, instead of global jubilation, we see anxiety, warnings, and even alarm bells ringing from experts and aid organizations alike. Why are the very people who champion this breakthrough now pleading for urgent action and sounding the alarm? To truly appreciate the magnitude of this moment, let's revisit the history of the epidemic. Since the early 1980s, HIV and AIDS have claimed the lives of more than 36 million people globally. In the earliest years, a diagnosis was almost invariably a death sentence. Entire communities, especially in sub-Saharan Africa, but also in North America, Europe, and Asia, were devastated. As the world watched in horror, the scientific community rallied. The introduction of antiretroviral therapy in the mid-1990s transformed HIV from a swift killer into a chronic, manageable condition. Suddenly, what was once a death sentence became a lifelong condition that could be managed with daily medication. But the battle was far from over. The virus proved stubborn, adapting and persisting in the shadows of the world's poorest neighborhoods, prisons, and marginalized communities. In response, the world mobilized like never before. The creation of massive global health initiatives, like the President's Emergency Plan for AIDS Relief, known as PEPFAR, and the Global Fund to Fight AIDS, Tuberculosis, and Malaria, ushered in a new era of hope. Since 2003, these programs have saved an estimated 26 million lives through prevention, treatment, and care. They have brought HIV drugs to remote villages, educated millions about prevention, and established a vast network of clinics and health workers. Yet despite these Herculean efforts, the virus remains a formidable foe. More than 600,000 people still die every year from AIDS-related illnesses, and new infection rates, particularly in low- and middle-income countries, have stubbornly refused to drop. In some regions, the epidemic is even resurging. Stigma, poverty, and social inequalities keep the virus alive. Daily preventive pills, known as pre-exposure prophylaxis, or PrEP, marked another milestone. These pills, when taken consistently, are highly effective at preventing HIV infections. But real life is complicated. Stigma surrounding HIV, the fatigue of taking daily medication, the chaos of daily life, especially for women, adolescents, and marginalized groups, all contribute to low adherence. Many people simply cannot or do not want to take a pill every day for years on end. Consider, for example, a young mother in rural Kenya, juggling childcare, work in the fields, and family obligations. For her, remembering to take a pill every morning may be impossible. As Dr. Linda Gale Becker, the director of the Desmond Tutu HIV Center in Cape Town, so succinctly puts it, "Prevention is the absolute cornerstone to bringing this epidemic under control." Enter lenacapavir, a potential game-changer. This medication offers protection through a single injection, administered just twice a year. Clinical trials have produced results that are nothing short of breathtaking. Among thousands of women and adolescents who received the injection in major studies, not a single one became infected with HIV. In another trial that focused on men who have sex with men and on transgender individuals, the injection was found to be 96% effective. These results have galvanized the global health community. The World Health Organization has formally endorsed lenacapavir, describing it as the dawn of a new era in HIV prevention. The Global Fund, in partnership with Gilead, has announced plans to introduce lenacapavir in Africa by the end of next year. The excitement is palpable. Experts describe the findings as spine-chilling, in the most hopeful sense. The promise is enormous. For the first time in history, we have a tool that could rival the effectiveness of a vaccine, but without the complexities and challenges of vaccine development. But as hope rises, so do the obstacles. The very infrastructure required to deliver this breakthrough is under threat. Instead of preparing massive rollouts of this miracle drug, many public health organizations are fighting simply to keep existing treatment programs alive. The reasons are sobering. Political turbulence, funding cuts, and policy reversals have thrown the global fight against HIV into uncertainty. Aid organizations report that funding cuts, particularly the recent shutdown of major USAID programs, threaten to unravel 2 decades of progress. PEPFAR, widely credited with saving millions of lives, has been hobbled by political infighting and reduced budgets. In South Africa alone, thousands of frontline health workers dedicated to HIV prevention and treatment have lost their jobs. Clinics that once buzzed with activity are now struggling to keep their doors open. Dr. Devorah Joseph Davy, an infectious disease epidemiologist at UCLA working in Cape Town, has witnessed the fallout firsthand. She reports that this year, in just 5 months, as many infants have been born HIV positive as did in the entire previous year. She tells the story of a pregnant woman who missed her life-saving medication after her nurse was laid off. With no one to perform a crucial blood draw, the woman's health, and her baby's, was put at risk. The problem is no longer just the virus, it's the crumbling support network. Carmen Perez Casas, a senior strategy lead at Unitaid, underscores the urgency. We need a low-cost product and also a low-cost delivery mode. Yet the system for delivering those drugs has changed radically. The challenge is not just manufacturing the medication. It is getting it safely, quickly, and affordably into the arms of those who need it most. This requires a vast, well-coordinated network of doctors, nurses, counselors, pharmacists, lab technicians, community workers, and data scientists. Every link in this chain is essential. When one breaks, lives are lost. So here we stand, perched on the brink of a technological and medical revolution. Yet just as the world's best hope arrives, the scaffolding needed to deliver it is collapsing. Could this historic breakthrough slip through our fingers, leaving the world more divided and more vulnerable than ever before? Or is there still time to turn the tide? Let's consider the scenarios. If these obstacles persist, the consequences could be dire. The next few years will determine the fate of lenacapavir. Will it transform global HIV prevention? Or will it become another lost promise, buried under the weight of politics and economics? On the optimistic side, imagine what would happen if global leaders step up to the challenge. If governments and organizations restore funding, cut bureaucratic red tape, and negotiate lower drug prices, the world could witness a dramatic drop in new HIV infections. This progress would bring us closer to the ambitious UNAIDS goal, ending AIDS as a public health threat by the year 2030. Visualize millions of vulnerable people across Africa, Asia, and Latin America finally able to access this twice-yearly injection. No longer chained to daily pills, no longer at the mercy of unreliable supply chains, they would finally have real, sustainable protection. The hope is not just theoretical. Studies show lenacapavir is as close to an HIV vaccine as science has ever come, offering more than 96% effectiveness in key groups. If governments act now, thousands of infants could be born HIV-free, and entire communities could be spared the crushing burden of this disease. However, the other scenario is much less optimistic. If the global response continues to fracture, if donors fail to rebuild support, or if the price of lenacapavir remains prohibitively high, experts warn of at least 70,000 additional infections and 5,000 more deaths in just the next 5 years. Dr. Linda Gale Becker, an authority in HIV medicine, warns, if we lose prevention, we risk everything we've fought for. These choices are not abstract policy debates. The effects are already being felt. Funding cuts have resulted in the loss of thousands of healthcare jobs in countries like South Africa. Clinics are struggling, mothers miss vital appointments, and babies are born with HIV. Tragedies that could have been prevented. Some may believe that the crisis is distant, confined to faraway lands, but global health threats know no borders. The COVID-19 pandemic illustrated with brutal clarity how quickly setbacks in one region can reverberate everywhere. Zooming out, let's look at the ripple effects on global economics and technology. The cost of inaction is not just measured in human lives, but in lost productivity, increased healthcare spending, and stunted economic growth. In many countries, the HIV epidemic continues to sap the strength of communities, keeping children out of school, parents out of work, and health systems perpetually overwhelmed. Economic studies have shown that every dollar invested in HIV prevention and treatment returns multiple dollars in increased productivity and reduced healthcare costs. A healthier population is a more prosperous one. Technology, too, plays a pivotal role. The development of lenacapavir itself is a testament to the power of modern science, leveraging structural biology, advanced chemistry, and decades of research. The story of HIV is also the story of innovation, from the first blood tests in the 1980s, to rapid diagnostic kits, to the digital health platforms that now help track treatment adherence and outbreaks. Yet technology alone cannot overcome the barriers of cost, stigma, and broken systems. The digital divide gaps in access to mobile phones, internet, and digital literacy can hinder the spread of vital information and support. So what does all of this mean for you, the viewer? First, it is a powerful reminder that scientific breakthroughs, no matter how remarkable, are not enough on their own. They require vigilance, advocacy, and above all, political will. Every individual has a role to play. Staying informed helps you challenge misinformation and push leaders to prioritize health funding. Supporting organizations that champion affordable medicines can make a tangible difference in the lives of countless people. For students, tech innovators, and future policymakers watching, lenacapavir offers a vital lesson in both the power and the limits of medical technology. The next wave of breakthroughs, whether in HIV, cancer, or pandemic preparedness, will only fulfill their promise if they reach everyone, everywhere. That demands creativity not just in the laboratory and the clinic, but also in policy, logistics, and community engagement. For example, the rollout of COVID-19 vaccines taught us that even the most effective tools can falter if distribution is inequitable or public trust is lacking. Let's also not forget the broader research landscape. While lenacapavir is a monumental step forward, researchers are continuing to pursue the ultimate holy grails: a sterilizing cure for HIV and a broadly protective vaccine. Recent advances in gene editing and immune therapies offer glimmers of hope, but these solutions remain years, if not decades away from widespread use. Until then, long-acting preventatives like lenacapavir may represent our best shot at bending the curve of the epidemic. Yet, access remains the linchpin. Médecins Sans Frontières and UNAIDS are actively urging Gilead to reduce the price of lenacapavir, especially for low- and middle-income countries. The World Health Organization has endorsed the medication as an additional HIV prevention choice, and the Global Fund's partnership with Gilead aims to distribute lenacapavir to those most in need. First generic shipments are projected by the end of 2027, but that is still years away. In the meantime, global health agencies are anxiously awaiting Gilead's pricing decisions to determine how far existing funding can stretch. The process of getting lenacapavir to patients is complex. It requires not only manufacturing the drug but also identifying those most at risk, getting them tested to confirm they are HIV negative, providing counseling, and ensuring they return for follow-up testing and injections. This chain of care, which includes doctors, nurses, pharmacists, community health workers, and data scientists, was largely supported by PEPFAR and similar programs. The impact of funding cuts is therefore profound, causing a breakdown in this delicate web of support. There are also legal and ethical considerations. As governments negotiate access and pricing, questions arise about intellectual property, compulsory licensing, and the balance between rewarding innovation and ensuring public health. History offers parallels. The struggles over access to antiretroviral therapy in the early 2000s led to global campaigns and, ultimately, to the widespread availability of generic drugs. Activists, scientists, and politicians alike will need to channel that same energy and determination today. What about the future? If the world rises to the occasion, the rollout of long-acting HIV prevention drugs like lenacapavir could radically reduce new infections, potentially achieving UNAIDS' goal of ending AIDS by the year 2030. But this outcome hinges on sustained funding, effective distribution, and continued political commitment. Conversely, if political interference and funding cuts continue, we risk a resurgence of the epidemic. As history has shown, progress against infectious diseases can be alarmingly fragile. Let's also consider the human stories behind the statistics. In the bustling clinics of Nairobi, in the remote villages of Nigeria, in the urban centers of Brazil and India, millions of people are waiting. For them, lenacapavir is not just a medical advance. It is a lifeline, a chance to break free from fear and uncertainty. A young woman in Johannesburg, who once faced the daily stigma of taking HIV pills, could now receive protection in just 2 visits a year, preserving her privacy and dignity. A transgender teenager in Bangkok, often marginalized by the healthcare system, could finally access a preventive that fits their life. But the clock is ticking. As bureaucratic inertia and funding battles threaten to stall momentum, The risk is that lenacapavir's promise will remain out of reach for those who need it most. The story of HIV is replete with both triumphs and tragedies. Moments when scientific advances were squandered due to lack of political will, and moments when collective action changed the course of history. So as we look ahead, the question remains, will leaders bridge the gap and seize this historic opportunity? Or will the world allow caution, inertia, and division to prevail? The answer, for now, is uncertain. But history teaches that when the world commits, when governments, scientists, activists, and ordinary citizens unite, extraordinary progress is possible. 2 decades ago, a diagnosis of HIV was a death sentence. Today, thanks to science and activism, millions are living long, healthy lives. Lenacapavir could be the next turning point, if, and only if, we all demand action, accountability, and compassion. So what can you do? Stay engaged. Share this story with your friends, family, and social networks. Ask your representatives what they are doing to support global health funding and equitable access to medicines. Support organizations that advocate for affordable, life-saving healthcare. Educate yourself about the issues, challenge misinformation, and lend your voice to the call for justice and equity. Because the fight against HIV is not over. The next chapter will be written not just by scientists in the laboratory, but by all of us, through the choices we make, the leaders we support, and the values we uphold. If you found this analysis insightful, subscribe for more stories at the intersection of global economics, technology, and health. Remember, sometimes the most powerful breakthroughs depend not just on science, but on the decisions we all make together. The future